Precision meets premium. In a premium cataract surgery, every step matters. Today I will demonstrate the use of CapsuLaser, selective laser capsulotomy, combined with implantation of a trifocal toric intraocular lens where precision, centration, and alignment come together to optimize the final result. The procedure starts with careful reference marking of the cornea with a toric IOL. Accurate identification of the intended axis is essential. These reference marks will guide the final rotational positioning of the IOL at the end of the surgery. After entering the AC, the anterior capsule is prepared for selective laser capsulotomy by injecting capsule blue to stain the anterior capsule. The capsule laser patient interface is positioned over the cornea, allowing the laser treatment pattern to be accurately focused and centered on the anterior capsule. Here, my objective is not simply to create a capsulotomy, but to create a predictable, circular, and well-centered opening appropriate for premium IOL. The laser energy is delivered circumferentially to the stained anterior capsule. A precisely sized and circular capsulotomy is created. The free capsular disc can then be removed, leaving a clean and regular capsulotomy edge. Hydrodissection is performed and the nucleus is mobilized. Then phacoemulsification proceeds in the usual fashion. Actually, I preferred horizontal chop technique. Also, these are standard steps of cataract surgery. Maintaining a stable capsular bag is particularly important when the final goal is precise positioning of a trifocal IOL. The remaining nuclear fragments are emulsified and removed under controlled fluidics. Throughout this stage, the integrity of the capsular bag and the geometry of the capsulotomy are preserved. This provides a stable platform for the subsequent premium IOL implantation. Meticulous cortical aspiration follows. A clean capsular bag is important not only for safe IOL implantation, but also for allowing the lens to unfold freely and settle symmetrically within the bag. At this stage, we are preparing the eye for the most refractively important part of the procedure. The trifocal toric IOL is now injected into the capsular bag. The lens unfolds gradually and is positioned completely within the bag. With a premium toric IOL, implantation is only the beginning. Centration and rotational alignment are critical components of the refractive result. The IOL is carefully rotated towards the predetermined target axis. Notice the relationship between the lens and the capsulotomy and the corneal reference marks. The regular capsulotomy provides an excellent anatomical reference around the optic, while the toric markings guide rotational positioning. After removing the remaining viscoelastic, the rotational position is checked again. This is an important step because the final axis should be confirmed only after the lens has settled within the capsular bag. Fine adjustment is performed until the toric marks correspond precisely with the intended axis. And this is the final result, a well-centered trifocal toric IOL accurately aligned on the intended axis surrounded by a regular capsulotomy with continuous 360-degree optic overlap. This is where precision meets premium, combining selective laser capsulotomy with the premium IOL technology to make every step as reproducible as possible. Precision in the capsulotomy, precision in centration, and precision in the alignment. Thank you for watching.